All right, so obesity is a real problem, but the good news is there is now a real solution. The biggest pharma revolution of our times, anti-obesity drugs are here. But the question is, who is it for? We so casually say things like, we are fat. But did you know that there are different kinds of fat? Are you clearly clinically fat, or is it just in your head? Perhaps beauty magazines making you feel that way? And importantly, can your kind of fat actually be treated by weight loss drugs? Here's an explainer to give you all the answers. By now, we all know how revolutionary GLP-1 drugs are. What they do, how they help, is not an unknown secret. But what's perhaps most important, and where all the debate lies, is who is it for? Can it work for you? How will it impact your body cells? And critically, are you really that fat that you need weight loss drugs? Well, I have often asked myself these questions, so after speaking with some of India's finest doctors, this is what we found. The first thing to remember, do not jump in to calculate your body mass index or BMI. Its definition is being challenged and questioned as a sole parameter of obesity. Someone, especially Indian body type, with high BMI may have a lot of bone and muscle mass. Someone with moderately high or even normal range BMI may have body fat percentage, meaning BMI does not conclusively define a fatty body. So, what does, you ask? Let's take you to point number 2. A good way to determine fatness, especially in the Indian context, is to calculate the waist to hip ratio. First, measure the waist circumference and position it right above your belly button. Then measure the hip circumference done at the widest part around your hip. Now divide the waist with the hip to get what will be your waist to hip ratio. For South Asian men, it should be sort of under 0.9, and for South Asian women, it should be under 0.8. Let's move on to point number 3, which is the body fat percentage. Now, this is the most clinical way to determine fatness. The Endocrine Society of India has suggested that it should be 25% for men and 30% for women. The catch here, however, is that it's difficult to ascertain your body fat percentage without professional help. But there are several methods to calculate that. For example, there is a DEXA scan. Ask your doctors about it. It's the most accurate clinical method. What the DEXA scan does is uses low-level X-ray to differentiate bone, muscle and fat, typically done in a medical or research setting. There is also the skin fold test. Now, this involves pinching the skin at various locations to measure fat thickness using clappers. Now, this requires skin fold clappers and the experience for consistently and accurately calculated, again to be done under supervision. Let's move on to point number 4, the skinny fat. The skinny fat phenomena. Now, the person with BMI 26 may not appear overweight, but could have body fat as high as 38% concentrated around their belly. BMI works on the assumption that all fat is the same, yet the fat around the arms, around your thighs and arms, are not as harmful. Many Indians tend to have skinny fat, that means having thin arms and legs but a big belly, and that is dangerous. Talking about that, let's move on to the next one, which is the visceral fat, the hidden risk everybody warns against. Now, roughly speaking, 90% of the fat in a person is what can be seen on the outside. The remaining 10% is inside the abdomen, called the visceral fat, as it surrounds the internal or the visceral organs, such as liver, kidney. It's the fat you cannot pinch. It's the visceral fat that doctors need to target in the clinic. Visceral or central fat produces toxins, the bad hormones that increase insulin resistance and also suppress insulin secretion. For example, you may not have high BMI, you may not even look overweight, but you might still have high levels of fat around your organs, and that can be extremely dangerous. It also means that you're extremely unfit. And if such a person gets diabetes, you could benefit greatly from GLP-1 drugs. So those are the things to remember. But also importantly, do take into note that India has now entered the big league weight loss drugs market. That means drugs like Mounjaro, Wegovy are out. The demand is real. The drug sales are surging and generics are already on the horizon. But these drugs are not cosmetic solutions. They are evidence-based medical tools designed to tackle chronic metabolic conditions such as obesity, diabetes, particularly when diet and exercise by themselves fall short. Now, these are general guidelines, remember, but before starting your weight loss drugs and medication, do ask yourself these 5 questions that we said, but also the following to your doctor. You must consult an endocrinologist for obesity specialty. Also determine your body type, amount of body fat, not just your weight or BMI. Discuss your lifestyle, your dietary habits, and your metabolic history with your doctor. Take informed decision and make it the right choice.